Hi guys, this is Dr. Yalda from the Beverly Hills office, and today we're going to talk about cracked teeth. I want to show you a couple of photos of some cases where patients had very deep cracks or even hairline cracks and were not treated in time and therefore required more extensive treatment. So the first case I'm going to show you is a case where the patient has an amalgam restoration. Now, love-hate relationship with amalgam. It's an amazing material that a lot of you have in your mouths. It lasts a very long time, but unfortunately it does expand, and when it does expand, it applies pressure and forces to your tooth. Coupled with the force from the adjacent teeth and you're biting and you're chewing all day long, you can end up with a crack. So when we see something like this and we see a crack at the back of your tooth and we point it out to you, we are trying to prevent something like this happening where an entire cusp falls off below the gum line. When it falls off below the gum line like that, sometimes it's actually non-restorable, and a small crack that could have been fixed with a crown is actually now an extraction. I'm gonna go flash forward to the next case. In the next case, similar situation. This patient has had a crack for quite some time and was just kind of waiting and not really doing treatment. When it came time to treat it, we took out the amalgam and you can see the crack actually extends significantly deeper because it's been there for much longer. So rather than just a crown, now the patient actually needed a root canal. Still treatable, still keeping the tooth, but it just needs that extra step. So the nerve was removed from the tooth and then the tooth was treated with a crown. I'm gonna go forward to the next case, another amalgam that kind of destroyed this patient's tooth. Same thing back here, there was a pretty big crack that we could see during an exam, and when we went to treat it, it was actually too late. The crack was deeper than we thought, and it was at the level of where the nerve is. So when the crack is that deep, same situation, we have to go into the tooth, treat it like we would with a root canal, take out the nerve, and then put a crown on top and just hope that the crack doesn't propagate any further. These are usually a more guarded prognosis. If there's a crack and you don't treat it soon enough, sometimes it actually is gonna fail regardless, but we always attempt to do a crown and chase the crack and stop the crack from propagating deeper. I'm gonna go to the next case, and in the next case, very similar situation, something I see almost every single day, a large amalgam restoration with cracks kind of all four sides. When that amalgam comes out, you can see, same thing, it's a little bit on the deeper side, but still restorable. Now in this case, we are choosing to do an onlay preparation just to try to conserve this cusp right here. This is more of an onlay 3/4 crown. It does remove the cracks, but sometimes you don't catch it soon enough and you still need that full coverage crown just to pull the tooth back together, because if there's a crack and you don't remove it, it is gonna get deeper. The last and final case is actually, I say my favorite because the pictures are really good, but honestly a very tragic scenario. So this patient presented, there was a hairline crack that we could see during the exam right on the side here, kind of going straight through the middle. Now, had this patient accepted the treatment of the crown, they wouldn't have ended up with the extraction that they needed several months later. In this picture, you can see several months later, the crack has propagated significantly deeper, and now the tooth is actually split completely in two here. So this tooth, unfortunately, it was way too late to save it with a crown. Unfortunately, that tooth needed to be extracted and an implant was placed in its place. So when we talk about cracked teeth, when we point it out to you at your exams, take it seriously, because I don't want to be pulling your teeth.